Hey everybody, welcome back to Fertility Fact or Fiction, and we have a really great presentation set up for you guys tonight to talk about the 5 biggest lies regarding COVID vaccination. I prepared a whole PowerPoint for you, so we're gonna really wait as long as we can to let everybody jump on because I want to make sure everybody gets a chance to watch this. And hopefully we'll get lots of questions and lots of feedback. I thought this would be a really important topic because there is so much misinformation out there. And so I did the research for you, I did the investigations for you, and I want to go over the actual data on what is available and what is not available in regards to whether or not the vaccine has any impact. So we will be starting shortly, and I have to thank Tarek, who has been scrambling to get this ready because I literally was just doing an ectopic pregnancy and walked in the door about 5 minutes ago. So it's been a little rushed, but he pulled it off. So here we are, and hopefully you guys have a good view of everything in here, and we can get going shortly. So let me know when we've got enough people on board that you think it's sensible to start, and we'll get started. In the meantime, if you have any questions you want to ask, feel free to post your questions, and we will get to them after the presentation part of the show is done. And certainly during the show, if you have questions, by all means, pop those up as well. Just had great news from one of our patients who actually followed our protocol. Kind of ignored the ones from her own center and just got her first positive after multiple failures. So really excited for her. So congratulations. And yeah, to everybody out there who's trying, our heart is with you. And to those of you who come to us, we're definitely going to do our best to help you through your journey. So hang in there and we will get you there for sure.
Instagram's going full speed ahead.
So. Instagram's going full speed ahead. Okay. So I'm going to get started. If there are any glitches, forgive me, but we will get going on this and we'll see how things go. So this is called, and this will be up on our YouTube channel. So make sure you click that like, make sure you comment, and please subscribe. And if you're on Instagram, follow us as well. So it will be a little bit harder on Instagram because Instagram is this way and PowerPoint is that way, but we'll do our best. So this is called the 5 biggest lies about COVID vaccine and fertility. And obviously I'm Rahi Victory. I'm a fertility specialist, and I'm board certified both in Canada and the US if you haven't met me before. So we do a little bit of work on both sides, and we have a big international clientele as well. Okay, so who do you believe? There is an enormous amount of nonsense out there in regards to what does happen and what does not happen when you get a COVID-19 vaccine. And so people are scrambling, and every day somebody comes up with something new that they claim is doing something or causing something from the vaccinations. No proof that it does, nor would I tell them it doesn't do something if there's no proof that it doesn't. Okay, so let's start with number 1. First, I want to explain that there is not a shred of proof to any of these claims that people have made. So if you look through the internet, there is no scientific data, nothing published on PubMed or any other site that is actually scientific, that can be verified and validated, that demonstrates that there is any validity to any of the claims being made in regards to COVID vaccines and fertility. Let's take a basic look at what's actually happening when you get a COVID vaccine. So how does it actually work? Now I'm going to skip AstraZeneca and Johnson & Johnson because we're going to focus on Pfizer and Moderna. And if you're trying to get pregnant, I'd actually recommend you stick with those because we know less about the other ones, but we know a lot about Pfizer and Moderna. Okay, so step one, you get the shot, the blood system picks up the vaccine, it's in your blood and it's floating around. Step two, the mRNA goes into your cell, it attaches to this thing called a ribosome, and you make a small fragment of spike protein. Whoops. You then grow the vaccine. Sorry about that. That's going a little too fast. You then grow the vaccine as the little bit of spike protein. So you'll see that in just a second. So you're landing your mRNA on the ribosome. The ribosome makes a little fragment of spike protein. So those green squiggly lines are the spike protein being mass produced inside the cell. Okay, so it starts to increase in production and eventually it gets out of your body and out of the cell, and your immune system recognizes it and creates those antibodies. Those are those little Y-shaped things coming off. Oh, and that video did not work. Of course it didn't. So that video shows the antibodies attacking the virus and it disintegrates it and you're done. Okay, so that part is very straightforward and simple. Let me give you a more simple version of it. And we've got the beach ball of death down at the bottom here.
I see that.
So I don't know.
You're lucky you got the other camera going.
Yeah. I'm not sure if it's going to let us do anything. Oh, that might be a problem.
Oh, it completely.
There we go. Let me just re-spool that. Okay. So I'm going to show you guys this again. So we can skip this. This is the mRNA, lands on the ribosome. You make the protein product. Protein accumulates in your cell and it eventually busts out. Your immune system recognizes it, creates antibodies. The antibodies now remember that, and if you get coronavirus, they destroy the coronavirus. So super simple. Now, just so you can see this screen, this mRNA gets destroyed shortly after it's in the cell. It's highly unstable. And all these little protein fragments, they get chewed up by the antibodies and your immune system destroys them. So all you're left with are antibodies. And those antibodies cannot do anything in your system to cause any of the things that people claim they can. Otherwise, every time you got a common cold, which coronavirus is kind of the father or mother of, you would end up with some kind of horrible disease afterwards rather than just a common cold. Truth is, when you get any kind of infection, you'll frequently mount an antibody response, and those antibodies can't do anything to you or your pregnancy when it's mounted against an infection. Okay, there are certain conditions where antibodies can be a problem, but not when it's against a simple infection. So let's take a look at that and see how that plays out in these different claims. So can it cause infertility in women? So I did a PubMed search. There are no studies showing any change in female fertility. There are no studies demonstrating any change in menstruation, which we'll go over again. And there is no biological mechanism to explain how it would, because all you're left with are antibodies. And you have billions of antibodies running around in your bloodstream right now. So if those antibodies are causing some kind of immune, issue for you, it's not affecting your fertility. There are women that have immune-mediated infertility. It's not from antibodies. It's from natural killer cells and from T helper 1 to T helper 2 cell ratios. It does not get mediated through antibodies. So it's a totally different mechanism. Therefore, lie number one is that your antibodies or the vaccine can cause female infertility. Remember, all you're left with are those antibodies. They don't affect estrogen, they don't affect your eggs, and they certainly don't affect your ovaries, uterus, or tubes. So it's not going to impact anything, okay? It can't. It literally cannot do that. So lie number one, poor little puppy, looks very bashful. It can't cause infertility. The COVID vaccine does not cause female infertility. It can't do anything like that. Number two, does the vaccine cause male infertility? Well, directly, no. There is no impact of the vaccine itself on sperm parameters. And they've actually studied that and showed that there is no impact on the sperm, the testicle, the epididymis, erectile function, hormones, nothing. There is no impact from the vaccine itself. The only way you could get an effect, which would be temporary, is if you develop a fever, because there are studies that demonstrate that up to about 11% of patients will respond with fever. And if you get a fever, we know from other studies that fever can actually reduce your sperm performance. So a study of 43 men in an IVF center showed no difference in any semen parameters in men who had been vaccinated. So there is no change unless you actually get a fever. Okay, so scientifically, we have some studies, granted they're small, but there is absolutely no evidence to support the concept that the vaccine is going to affect male sperm parameters. Only if you get a fever, and then you're talking about maybe a couple of days worth, maximum a week's worth of sperm that is suboptimal. The rest of the time it would go back to normal, because remember, as males, we produce sperm every day. So even if I wipe out today's sperm, we're making new sperm tomorrow and the day after, which won't be affected again. So it's a short-term thing, and it's only if you get a fever. Only 11% of people are responding with fever. So you're actually talking about, and that included women. So probably it's like 5%, 5.5% of men. So a very small percentage are actually going to have a sperm issue from this. So lie number 2, does the vaccine cause male infertility? It absolutely cannot cause male infertility. At most, you'll get a little bit of an alteration in your sperm performance if you develop a fever. Does it cause miscarriage? We have the hallowed New England Journal to answer this for us, and this didn't work out the way it was supposed to. So sorry, it's overlapping here. It is biologically impossible for the vaccine to cause miscarriage, okay? All this mumbo jumbo down here, which we will clean up for you in the final presentation, says that it was 13.1% in the study that had a miscarriage. And in the actual reality, we get about 1 out of 6, which is 17.6%. So there is no chance that it's causing miscarriages. Now, initially, the big report was that the vaccine caused miscarriages or would cause miscarriages. It was even before they had done it, because it was attacking a sequence of amino acids, 6 specifically, which is relatively meaningless in protein language, but 6 amino acids in a row that were the same on a placental protein, which was very important. And so they said, oh, because it's the same sequence, that it's going to cause a problem. The problem is coronavirus spike protein has that same sequence of 6 amino acids as part of its huge sequence on the protein, but the mRNA vaccine does not code for that region. So the antibodies are not attacking that region, they're attacking a totally different part. So that claim is absolutely false. There is no evidence for that, and a study of 976 patients demonstrated a reduced risk of miscarriage, not an increased risk of miscarriage. So lie number 3, COVID vaccine causes miscarriages. It's 100% untrue. Neither can it nor does it cause miscarriage, okay? Finally, does it cause menstrual changes? Well, first of all, there's no biologically plausible or possible mechanism, okay? You've got antibodies, that's all you're left with. So it can't really cause a menstrual change. There's no reported long-term impact. There's not a single study published anywhere that demonstrates that it does. And there is no evidence of any menstrual changes that are actually a result of the vaccination. And when you look at experts, they all say, we think it's coincidental. Nobody believes that it's due to the vaccine. On top of that, if you look at the number of women and men vaccinated in the US, as of this morning, it was 309 million people that have been vaccinated. Okay, so they've almost got the entire US population, vaccinated with 1 dose. And in total, fully vaccinated is 144 million, okay? So if we assume that half of that population is vaccinated, or even if you take the 144 million, it's roughly the same numbers. If you look at VAERS, which is the adverse events reporting system where people can self-report their complications, I looked at it this morning. There are 1,497 reports of people saying it changed my menstrual cycle. Most women said it was earlier, some said it came a little bit later, but that's what it is. So when you do the math, it works out to 0.00096%, or 1 out of over 100,000 women getting vaccinated that have had a menstrual abnormality, none of them saying that this is being persistent or ongoing for months. So even if you do get a slight menstrual change, and there again is no biological mechanism by which the vaccine can do that, there is an extremely, extremely low likelihood of that happening, number one. And number two, more importantly, it's not going to be, long-term. It's super temporary. Within probably 1 month, it's going to be over and you're going to go back to normal. So number four, the COVID vaccine causes menstrual disturbances. It does not. There's not a shred of proof that the vaccine is responsible for these menstrual disturbances. 309 million doses, you've got 1,497 women saying it did. Maybe it did, or their period came earlier or later. That's random chance, guys. We all know women's periods can come and go at different times. Even if you were super regular, maybe just the stress of everything going on could have done that to you. Finally, does the vaccine reduce your chances with IVF? So the answer is simple. The answer is no. There's a study out there. They looked at couples going through IVF. They had all received their vaccine first, and they then did IVF within even 7 to 85 days, okay? All of them had been vaccinated and then went through these cycles. They saw no differences in ovarian stimulation, embryological variables, or pregnancy rates before or after the vaccine. So there's research already out there demonstrating that it has absolutely no impact on your fertility, even if you're getting assisted reproductive assistance or help. And so even if you're doing IUI, IVF, any of those things, the vaccine is not going to cause a problem. Now, do I support people running off and doing embryo transfers right after vaccination? I actually tell people to hold off. Not because I believe that the vaccine will do anything, but because you're always going to blame the vaccine if something goes wrong, even if we don't know that it's the vaccine that is responsible. So what we're trying to tell people to do is hold off about 2 months from your first shot. Your immune system will settle down. At that point, you can go ahead and get your vaccine, get your embryo transfers or do your IUIs with no harm or damage done. 2 months has no impact even on someone with diminished ovarian reserve. We've presented that before on Instagram. I think even in one of our live shows, we've talked about that as well. Up to 6 months, even with diminished ovarian reserve, there's no change in your outcome. So there's no reason to panic. You can get vaccinated, wait, and then go. So lie number 5, COVID reduces your chances with IVF. Fake news. Vaccination has no impact on IVF outcomes. Okay, what happens if you actually get COVID while you're trying to get pregnant or once you're pregnant? So let's look at the other side of this, right? What happens if you don't get vaccinated because you're worried, but you end up getting COVID while you're pregnant? Higher risk, or even before you're pregnant. Much higher risk of menstrual disturbance. COVID itself can alter your menstrual cycle, and they have shown that. Much higher risk of miscarriage. Higher risk of preeclampsia, 430%. Higher risk of preterm labor and delivery, increased risk of ICU admission for severe disease, 22.3 times higher risk of maternal death, and decreased sperm performance for the guys. So not getting vaccinated has this huge list of problems, whereas getting vaccinated literally has none. You're not going to have any fertility detrimental outcomes. Okay, so what do we know? So there is no female fertility impact, no male fertility impact, no increased miscarriage, no menstrual change, and no change in your IVF success rates. And that's scientific. It's very clear. Everybody saying it affects those things is flat out lying or making up nonsense, because there's no evidence to support any of those claims, and there's evidence to say that actually they're not true. So that's the vaccinated group. They're not going to experience any of those things. What do you get if you're not vaccinated? Well, if you don't get COVID, you get nothing. But if you do happen to get COVID, and obviously millions of people have and continue to, increased risk miscarriage rate, increased risk of infertility, increased risk of preterm labor, increased risk of preeclampsia, ICU admission, and maternal death. So if you're sitting there weighing whether to do this or not do this, this is the easiest no-brainer in history. Please go get vaccinated. The people making up these stories about all the things that COVID vaccine can do don't even understand the biology of how it works. It can't do the things that they're claiming it does. It is biologically impossible for an antibody to impact your hormones or to change your menstrual cycle or to do any of those things. The newest one is that it's building up toxins in your ovary. Antibodies can't do that, guys. There is no way to do that. Some lunatic said it makes fat accumulate in your ovary. You accumulate fat in your ovary every month when you make a corpus luteum, which every woman that ovulates does, because the cyst that's left behind, which helps you produce progesterone to support a pregnancy, does it from the fat that's in that cyst that's left behind. And for any of us who have done surgery, or if you ever watch a surgical video on removing a corpus luteum, you'll see it's this yellow fruit nonsense. There is no truth to any of these claims. At the end of the day, and I love this meme, I think this is hysterical, everybody has to decide for themselves. You're either looking at science or you're talking about people that have nothing better to do than jump on their cell phone and come up with something somebody else said or they think and saying, this is a fact, my friend had this and it was because of the vaccine, when there's no scientific evidence for it. And that's why, because of this meme, we've all turned to calling them toilet seat scientists. And there's one for guys as well. I just happened to pick on this one because it was easy. But the reality is that there is no truth to the claims that are being made. Don't believe everything you read. A lot of these people just want to make noise for themselves so they can get more followers and they can get more likes. And it has nothing to do with being realistic or spreading the truth. And they certainly don't give a damn about your safety, because they don't know if you got COVID and you miscarried or ended up in the ICU. So are there any risks from this stuff? There are no risks from COVID vaccination related to fertility, miscarriage, pregnancy, complications in pregnancy, anything like that. None, zero. I've had literally hundreds of our patients pregnant, get vaccinated, none of them have had a problem. So if you are able to get vaccinated, please go get vaccinated. It is the most important thing you can do for your health and for the health of others and for your baby's health. And for your baby's health. If you are pregnant, go get vaccinated. Your baby will be safer because you're vaccinated. So I hope you enjoyed that part of the show. I'm happy to take your questions. Don't forget to like, comment, and subscribe on YouTube, and hit that follow button on Instagram, and we will be happy to take your questions. I guess I can just log out of this now, right? And just jump onto Restream. Okay. So you want me to just read them off of here, or you want to read them?
Oh, you can see them there?
I can see them there, yeah.
Oh, okay.
You just have to do the
show?
Oh, actually, no. I can't scroll. Only you can scroll.
Oh, okay.
So yeah, you can do Instagram and the other ones. And
all right, so let's see if there's anything related to.
Can everybody hear? Because the mic is.
Yeah, it was on and off, and now it's back on.
It's good.
Mm-hmm.
Okay.
One question related to this is, why were some docs saying wait to the second trimester to get vaccinated?
Again, it has nothing to do with the vaccine. It's about making sure that people don't blame the vaccine if something goes wrong. Your first trimester is a rocky, bumpy road often. People do not want to, get vaccinated and then have a miscarriage, or doctors don't want you to get vaccinated, God forbid, have a miscarriage, which has nothing to do with the vaccine, and then turn around and say, oh, look, I got the vaccine, I had a miscarriage. 1 in 6 are going to miscarry. So it has nothing to do with the vaccine. In fact, like I showed you, the vaccine has a lower rate of miscarriage, not a higher rate of miscarriage. So that's why doctors are saying wait till the second trimester.
Just see if there's anything related directly. Is there evidence related to birth defects in COVID vaccines? Is it too early to tell?
No, and there have been lots of babies born now since they've been vaccinated, and there's absolutely there isn't even a way to get a birth defect from a COVID vaccine. It's biologically not possible. So the people are saying that it's going to do this and that. Give me evidence of how that works. Look at any expert. They will all say the same thing, me included. There is no biological mechanism for how that could happen. It can't cause a fetal defect. It's impossible. It's absolutely impossible. Your baby would need to express coronavirus spike protein on an organ in order for that to happen. And if your baby did, that means your kid is the source of coronavirus. I mean, or you are. How the hell is that even possible? It's nonsense. So no, it cannot cause any problems in babies.
Do you see that? Oh, yeah.
Have there been any studies done yet on a mother who got the COVID vaccine while pregnant and the baby ended up with a health issue? There are no reported cases of fetal health issues from moms that got the vaccine. Zero. Not one single report.
This question here, I think, is your entire slideshow.
Yeah, so who did I just watch the earlier part of the show? That's all we were talking about. It does not affect fertility. Doesn't affect female fertility, does not affect male fertility, doesn't cause miscarriages, doesn't change your menstrual cycle, and it certainly doesn't affect IVF.
Okay. And then I just want to make sure I answer the COVID questions.
Yeah. Ask them all.
Yeah. Endometrial lining. I think we'll just go into the questions now.
Yeah, sure.
Last chance for anybody if they want a COVID question. Start from the top.
Fire away.
What is your typical protocol between retrieval and frozen transfers for endo patients?
3 months of Lupron and letrozole to totally suppress endometriosis. And then lots of vitamins, oftentimes surgery if we think it's more severe. And then we have like an endo supplement protocol. So we use turmeric, or curcumin powder. We use NAC and coenzyme Q10, all three of which have shown some benefits. So that's how we approach it. And then no estrogen when you go to do the transfer, or minimal. Is a saline infusion sonogram necessary before IVF? I would argue yes. There may be people that say no. I'm a perfectionist, so I like to make sure everything is correct before we go ahead. If it's anxiety or pain you're worried about, there is no anxiety or pain necessary as long as your doctor does it correctly. We have a great video showing exactly what steps to take, and we have a great Instagram post. So the video is on YouTube, the Instagram post obviously is on IG. So talking about saline infusion sonohistograms, the SIS YouTube video has 20,000 views, so feel free to jump on there. And bottom line is, I believe it's necessary because if you have a polyp or a fibroid, it will decrease your chances. If you are septate, it will decrease your chances. So I'm a believer.
Is Canesten vaginal tablets safe to take when TTC?
Yeah, there's no problem with taking Canesten or Monistat when you're trying to conceive. They're fine.
I had 15-day 5 embryos from my IVF cycle when I was 24 due to a tubal ligation after my 3rd baby. First FET was a live birth, 14 more embryos. Wondering how many live births to expect the 14 left.
From 24, 80% of your embryos would have been normal, roughly. So that would bring you down to about 11, and roughly. And then from the 11, every 3 will guarantee you almost a baby, 95.2% chance. So minimum 3 more. I would venture 6 to 7 more realistically. Someone's asking how long infertility lasts after getting COVID. We don't know. We don't know how long it lasts. Sperm parameters can be altered for months, like 3 to 4 months. For female infertility, we don't think it renders women infertile after you get COVID. So that shouldn't be an issue. But for men, it's probably 3 to 4 months. Thank you for sharing this great content. For natural unmedicated transfers, do you add letrozole in? Yes, because it has been scientifically proven to improve your chances, and then you don't need estrogen. And the less estrogen you use, the better off you will be. So we do use letrozole from days 3 to 7. There are actually now multiple studies which have demonstrated a benefit. We've reviewed one on the show, your camera show. And so that's on the YouTube channel as well. It's not the video about does letrozole cause problems. It's way back earlier on. That was like a year and a half ago, that show, I think. Year and a half, 2 years ago. Yeah. Yeah.
Dr. V, yeah.
Oh, yeah. Are you still recommending waiting 2 months post-vaccine before going through IVF? Not before IVF. I recommend 2 months post-vaccine before you do your embryo transfer. There's 2 reasons for that. So number one, the study that they published is admittedly small. It didn't show any differences, but it is small. Number 2, you are activating your immune system. And in a small percentage of the population, an overactive immune system can cause a problem in regards to conception. So I don't love the idea of trying to do an embryo transfer when your immune system is, all guns blazing, full steam ahead. The other reason, as I've said before, is if you fail or if you miscarry, you will always blame it on the vaccine. And we do not want people blaming the vaccine. So if you just wait the 2 months, the IVF itself is not a problem. It's the transfer that's the problem. So don't transfer your embryos until 2 months has gone by from your first shot, because by that time your immune system's calm. You can't blame the vaccine anymore.
Okay. Right here. Is a fresh embryo transfer okay for a first-time IVF cycle if there are no underlying issues?
Yes and no. So if your estrogen level is very high, then the answer is no. Because when your estrogen levels are high, your chances are lowered when you do a fresh embryo transfer. You're also at a higher risk of ovarian hyperstimulation syndrome. So that should not be done. The other reason is that the risks of the pregnancy are much higher. Preterm labor, IUGR, hypertensive disorders of pregnancy, all increase when you do fresh embryo transfers. And the theory behind it is that it is related to those supraphysiologic levels of estrogen. So we don't recommend that you do that. Having said that, if you have a low number of eggs or a low estrogen level, yeah, you can totally go for it. There's no reason not to try, because those patients are going to do fine.
Is there a maximum number of C-sections that you would allow someone to have and still perform an FET?
Oh, an FET. Wow. That depends on what's happening with your uterus. If your scar from your C-section is very prominent, it may hamper the results of the FET. If you have what's called an isthmusele, it may be very difficult to make it all work. So it depends on what's going on. Sometimes yes, sometimes no. But the bigger question is how many C-sections is reasonable? And the answer really is 3. Above 3, your risks of the placenta sticking to the uterus and not coming off, which is accreta, increta, or percreta, is very substantial. And those can be life-threatening for you and your baby. So we do not recommend you have multiple C-sections. That's not a great idea.
In an FET cycle, after 13 days of estradiol, the thickest part of lining is only 7.3 millimeters.
Sure.
Today, first PIO shot, thoughts on success. In general, menstrual cycle is very weak.
7.3 is good if it was triple layer. We'd be happy with that. So I wouldn't have any trouble transferring into a 7.3. As long as it was a triple layer and a nice lining, that wouldn't be a problem. Anything from like 7 to 10 millimeters is a reasonable number to go ahead. What is your opinion on Gonal-F, microdose HCG, and ganirelix protocol? 38 years old, above average responder. Yeah, basically that's what we do. So we use Gonal-F and Menopur, which basically has microdose HCG in it. And we use Cetrotide, which is the same thing as ganirelix. So yeah, I love that protocol. That's exactly what we do. We don't use just the actual HCG. We just use Menopur. And I find that combination of Gonal-F and the Menopur to be excellent. So I support that protocol. It's a good protocol. Thank you there for being there this week for my meltdown. You're the best. Krista, you're beautiful, and I'm happy I could help you. And no meltdown. You're an amazing person. Don't worry about it.
What is the purpose of aspirin, and how much should be taken when doing a transfer?
So we have an aspirin video. Watch it. Subscribe to our YouTube channel. Just click that button. Tart, put the button up there somewhere so you can subscribe. So subscribe to our YouTube channel. We have a video on aspirin. Actually, the aspirin video has started picking up a lot of speed lately too.
I noticed that. I didn't notice that actually.
So aspirin has multiple benefits. So first of all, you should take 81 milligrams baby aspirin. And the benefits are likely an increase in success. I say likely because the data is not 100%. Probably a decrease in miscarriage, but again, the data is not 100%. Reduction in preeclampsia, reduction in preterm labor, and then there are other possible benefits from it as well. So improves blood flow, reduces inflammation. So there's a lot of benefits to taking aspirin. Overall, when you analyze it, the benefits basically outweigh the risks, so you can't really go wrong taking aspirin.
Would you recommend bed rest after a frozen embryo transfer or resume regular activity?
Whatever stresses you the least. So if you're less stressed, resuming normal activity, resume your normal activity. If you're less stressed doing nothing, then do nothing. So whatever's going to stress you the least is going to give you the best result.
Good news, Facebook just dropped out completely for fun.
Did it?
Yeah.
That's a problem.
Just to keep you guessing.
Bye, Facebook.
Just dropped.
Can you bring them back?
Yeah, they're back now.
All right. Sorry, folks. If you were on Facebook for some reason, it dropped off. Welcome to modern tech.
Yeah. New video of Allison touring VRC was amazing. That's how I see here.
That's awesome. Was it from Allison? Did she send the message?
I don't know who it is. I don't think it's Allison, but it's somebody. That's so fun.
Allison is one of the most amazing people I've ever met in my life. Allie, if you're watching, we love you. And she and her whole family are spectacular.
Vaccine with sub-Q IG infusion. They ask about blood products in triage. Is it? I don't know.
So a sub-Q IG infusion and the vaccine is not a great idea because the subcutaneous IG, although minimal, has the potential to bind the protein that is being produced by the vaccine that you're supposed to mount an immune response to. That's sub-ideal. It's still going to probably work, but it might reduce the efficacy of the vaccine a bit. Hi, Rochelle. She's waving hello and saying hi, Doc.
Somebody asked, but why the change on the menstrual cycle?
There is no change on the menstrual cycle. And, you know, it's 1,400 women, almost 1,500, out of 309 million doses. It just, like, that's normal. Like, it's 0.00096% of women. 1 in 100,000 women. There's way more than 1 in 100,000 women that are going to have an irregular cycle this month. Way, way, way more. So it's not the vaccine, guys. It's just chance. It's totally random chance. That's all it is.
Did half ICSI and half IVF with 13 eggs retrieved. 5/7 fertilized with ICSI and 2/6 with IVF. Now day 3 and no IVF eggs grew. 4 continuing from ICSI. Does this mean anything?
It probably means the sperm is very weak. So sperm is responsible for the mechanism that pulls the embryo apart when it's dividing. So if you fertilize naturally, it probably means the sperm was weak and it can't help the embryo divide. Whereas the ICSI, you're bypassing that. So you're injecting it right in, and therefore the fertilization and the mechanisms are probably better. And you're cherry picking. So any sperm can get in with normal IVF. But we're cherry picking the sperm. We're picking the best sperm one by one when we do the ICSI. Our embryologist here routinely is getting 100% fertilization almost every time. And then lately, realistically from the beginning, in many, many, many cases, the embryos are all making it. So unless the patient has an egg problem or a sperm problem, every single embryo we fertilize is making it to blastocyst. Now, there are exceptions for sure. We have patients with suboptimal egg quality, suboptimal sperm quality, but most of our patients are doing very well and ending up with at least some blastocysts, and many with literally all blastocysts from whatever number of eggs they had. I've never seen that before anywhere. So bravo to Dr. Khosravi, our lab director. She's incredible. And Staffy, our junior embryologist. They're phenomenal. They're just absolutely phenomenal. And I've never seen anyone like them. So I love them dearly. They're amazing.
There you go. Big question coming up.
Hi, Dr. Victory. I'm in the US planning on doing IVF for gender selection. Okay. And I'm 35 in September and still nursing 2 babies. My question is, how often should I test my AMH until I'm ready to start IVF? I'd like to nurse them for a couple more years. Wow. Keep going. What's the rest of it?
I'll read to you. But I'm ready to start IVF. I'd like to nurse them for a couple more years, but I'm afraid it might be too late to start IVF then. So I wanted to use the AMH as an indicator of when to start. Thanks.
So your AMH likely won't be accurate because you're breastfeeding, which suppresses your hormones and your ovaries. So it'll probably artificially deflate your AMH level or decrease it. So there is no advantage to breastfeeding children for years. That's scientifically clear. There's no advantage to doing it for years. So I certainly wouldn't recommend that. And from a fertility perspective, you're right. If you wait years, you're going to decrease your chances of success with IVF. So if you are breastfeeding, I wouldn't even try IVF. I would wait till you're done your breastfeeding. You will diminish the number of eggs you produce, for sure, if your prolactin's high. And so I would stop the breastfeeding when your children are a year or so, which is all they need. And then I would go ahead and do your IVF. Great question. We've never had one like that.
Mm-hmm. Why would an RE want to do 50-50 ICSI versus IVF?
You know what? I should grab Fred Zaneku, my colleague in Toronto, and ask him because he does that routinely. We were just discussing it the other day. Okay, so I don't do 50-50. I just do ICSI, but I'll throw it out there so everyone knows. Realistically, when you're doing IVF, natural or conventional IVF, so no ICSI, you're allowing nature to pick the best sperm. So maybe hypothetically, there's an advantage to that. And that's why people are doing it 50-50. There is also a slightly increased risk of anomalies with ICSI. Now, we haven't seen it clinically, but it is published. So there are some reasons to do normal IVF. I don't, because our success rates are so good with ICSI, but there are people that believe in it. Fred does. I'll get Fred to ask. Fred, I don't think Fred watches, but Fred, if you're watching, message me and tell me why you do 50-50 IVF and ICSI.
Can the endometrial lining still thicken further once one start with the progesterone PIO shots? What would one do to ensure that the lining doesn't decrease?
Actually, you want the lining to decrease. You don't want it to thicken. So if your lining is continuing to thicken, it means you're not on enough progesterone or the progesterone's not working. Progesterone stabilizes the lining and shrinks it, it compacts it. So we actually use that to judge when the lining is ready. If our patients don't shrink after we've started their progesterone, we delay a day or we cancel. So you don't want it to thicken after you start progesterone. You want it to thin a little bit. So it's the opposite of what you're thinking.
So swollen lymph nodes during fertility treatment mean anything? A lymph node in my neck got very swollen and sore post-IUI, now again during IVF stibs. I had a bad case of mono 15 years ago.
Well, your immune system's active, and that is never a good sign when you're trying to do fertility. So I would go see an immunologist, figure out why your lymph nodes are getting enlarged, see if you're reacting to something, and then go from there. You do not want your immune system overactive when you're trying to get pregnant. I have a really quick one. I can answer that. I can
Sure.
see. Can IUI be used for gender selection? 100 million %. The answer is absolutely, categorically no. It is not possible, no matter what anybody tells you. You cannot gender select with IUI. There is a technology coming out where they claim it is possible. It is not available commercially yet.
Okay, here we go.
I'm with a new partner and we'll be getting a reversal, and she has low ovarian reserve. Should we try on our own first once my reversal is done, or should she go back and see you, or both of us together? I am 37 and she is 38 and I'm 37, sorry, and I have no children, and she...
Hold on, long question, sorry. And she is 37. I have no children and she has 3 older children.
Okay, so I'm a little confused. If I've got this correct, you're both female? I'm not sure about that part. And she's had her tubes tied, or you've had your tubes tied. Can you clarify that for me? Because I'm not quite sure I'm reading that correctly. But you should definitely both have investigations to see what's going on. If it's female, then younger is better, but not always. And if it's male, male getting a vasectomy reversal.
Yeah.
Okay. So if her tubes are open and you're getting a vasectomy reversal, depends on how long your vas deferens has been blocked. If it's more than 7 years, don't bother, it won't work. So that's a case for IVF. If it's less than 7 years that you've been blocked, then come in and we'll talk about it. We need to test her to see where her ovarian reserve is at before you jump into anything, because it could be costly and unnecessary. I got 4 embryos from my retrieval, 3 BB. One 4 BB. What's the odds of success with first FET? Too much missing from Live, Love, Fearless. Age, BMI, social habits, sperm quality, sperm DNA fragmentation, the lab. I love trying to answer those questions, guys, but it's impossible. I can only give you stats. If you have one genetically normal embryo, it's about 50 to 60% in the right hands. If you have 2, it's 84, and if you have 3, it's 95.2. Joel from earlier is saying her AMH is 7. Yeah, that's totally reasonable. If it's been less than 7 years for you in terms of the vasectomy, get a reversal and try. That's a reasonable approach to things. Yeah.
Can I still get pregnant with really short luteal phase, like 7 to 8 days?
Can you? Yes. Will you? It'd probably be difficult. So there are ways to fix that either with medications or progesterone support.
Unexpectedly fast on answering. Is there any evidence related to birth? Oh, we answered that already. Does the baby get some antibodies if mom was fully vaccinated with the mRNA vaccine?
Yeah, as long as the baby is in you, and for the first 3 months after it's born, it will have some of your antibodies, and then you can pass them while you're breastfeeding. And there was a question about breastfeeding and vaccination. You do pass antibodies to your baby, so you're protecting your baby from COVID if you've been vaccinated and you're breastfeeding your child. So that's a great reason to do so.
Got questions for you. Want me to read it for you?
Oh, sorry, I didn't say it.
Okay.
Septum resected from 1.4 down to 0.3. Still had a miscarriage at 7 weeks. Will IVF help? Well, that's a great question. It depends on why you had a miscarriage. So if it's age related and we don't know, what the embryo quality is like, yes, it would. If it's immune related, no. If it's, something wrong with your blood, like your blood's too thick, no. So it depends on what the cause was. We would have to investigate further and then determine. IVF is a great tool, but it's only a tool. If you use a hammer to try and crack a walnut, it's probably going to smash the walnut. So, you don't always need the big guns to try and solve problems. Sometimes you just need your immune system adapted, or antibiotics, or more sex, or stop smoking or drinking or drug use, or increase your vitamin intake. It doesn't always have to directly be IVF, and IVF is not the answer to everything.
I have another COVID question.
I have another COVID vaccine question. Yeah, I answered that one.
Okay,
Is
great.
it safe while breastfeeding? It's 100% safe while breastfeeding. It's protective for your baby.
Male factor infertility, and my husband just bought a Peloton. Is it okay because we do ICSI?
So bike riding has been proven to be detrimental. So no, get them off the Peloton while you're trying to do this stuff. Pressure against the testes or heat or those cycling pants that guys wear are not good for you. Now, if he's off the seat the whole time and he's doing the kind of standing on the pedal bicycling, that's great, but I don't think anybody can keep up that pace forever. Eventually you sit on the seat. Those seats are rock hard and certainly not comfortable. And so they do compress the boys, so to speak, a little bit. And that pressure is not good for sperm. So off the Peloton. Got my first vax today. God bless you. Doing first FET in August. Perfect. Any advice for anything I can do to maximize the odds of success? Yes. Vitamins, de-stress, yoga, meditation, prayer. Prayer is huge. Pray. Eat a healthy diet. If your weight is high, bring it down. If your weight is low, bring it up. And then follow our protocol. Letrozole, antibiotics, probiotics, no estrogen, double progesterone vaginal and in oil, steroids for 5 days. Make sure your lining compresses, get progesterone levels checked, get a very, very good transfer. Should be somewhere around 3/4 of a centimeter to 1.5 centimeters from the top of the uterus. You'll be pregnant. Even the patients that follow us and listen to our protocol get pregnant and text me and say, hey, we followed your protocol and we got pregnant when they weren't before. So it works.
PCOS diagnosis, recurrent miscarriage after letrozole.
So PCOS diagnosis is related to some extent with miscarriage. The data is a little fuzzy. Letrozole itself does not cause miscarriages at all. So the question would be, why are you miscarrying? So it can be related to a host of different factors. Weight, diet, social habits, smoking, drinking, drug use, sperm DNA quality, his smoking, drinking, drug use. It can be related to other habits, excessive heat, excessive exposures to chemicals, genetics, environment, your immune system, and then blood clotting, infections in your uterus and your cervix. There's a whole laundry list. So you got to figure out why you're miscarrying to be able to answer that.
Okay, I'll show this one.
What is the timeline if we wanted to proceed with a non-funded IUI? I think we still have funding for IUI here, and we have funding for IUI in Sarnia. So plus my Toronto colleagues all have funding, so we can send you there. So don't worry about funding, but regardless, you can do IUI funded or non-funded anytime you want. We can literally accommodate it like within 2 days as long as you've done your testing. So if you've done your testing, we're good to go whenever you are. If you haven't done your testing, you need to do your testing.
For FAT, my clinic does 113 hours of progesterone for a day 5 and day 6 embryo. Should I be concerned? I saw your video on day 5, 6 embryos, which is great, by the way. Thank you.
Great video.
Great video.
Okay, so my day 5, day 6 video shows that if you're a day 5 embryo, day 5 or day 6 is fine, but if you're day 6 embryo, you will reduce miscarriage rates by transferring after 6 days of progesterone. So yes, we don't recommend doing day 6 embryos after 5 days. We do it after 6 days.
Hi, my cycle was failed last month. For this month, I used testosterone gel, but now I have spotting before my period. Is that normal? I have never spotting in my life.
Well, it's certainly not normal, but spotting before an IVF cycle is irrelevant if you're doing a frozen embryo transfer, so we don't really care. As long as your hormones are okay when you start, you're fine.
Getting ready for my first transfer. Always love the show. How long after Lupron Depot does it take your period to return? I'm 6 weeks post last shot.
Depends if you took a 1 month or a 3 month. So if you took a 1 month, it'll usually get rid of your period for a month. So it'd be like 2 months and your period should resume. If you did a 3 month, it would be like 4 months, almost sometimes 5 months before your period comes back.
For an FET cycle, you mentioned that progesterone shrinks the lining.
Yeah.
What should the lining be just before the transfer? My lining is on the lower end, 7.3 today, first day of PIO progesterone.
Nobody knows. So that's the really interesting part about this. We don't actually know what your lining should be right before the transfer. So I would say still you want it in that 7 to 10 range, but even a 6.5, but you don't want it much thinner than that.
Is it possible to increase AMH if I do another test after a few months?
A few months. Is that the same lady that was asking about the breastfeeding the babies?
Let me scroll. I feel it's not. I don't recognize the picture.
Okay.
No, new question.
No, AMH will only go down if you are waiting longer. So your AMH will not go up unless you've been suppressed on the birth control pill. That's a different story. If you've done something that's suppressing your AMH, excessive stress, eating disorder, birth control pill, stuff like that, yes. But if you're just waiting randomly, no, that'll actually make it worse.
Why is there no estrogen in your transfer protocol?
Because estrogen is bad. So estrogen has been shown to increase complication rates and decrease success. So we try and minimize estrogen as much as possible. We only use it when we have to in menopausal women where they're not going to make estrogen otherwise, or in women that just aren't getting thick enough on the letrozole. How long can I bleed after a failed IVF? I got my negative beta HCG report on May 31st, started spotting on May 27th, and still have minimal spotting. Is it normal? No. 2 weeks later? No. So make sure you're off of all your meds and go back and redo your blood work. Something's off there. Is super fertility a thing where our body doesn't recognize a good embryo? We got pregnant on first try 3 times. Feeble heartbeat at 6 weeks, miscarried at 7. Also had subchorionic on hemorrhage, AMH of 7.7 picomoles, AFC 7, age 33. There is a belief, there's a guy named Macklin and a couple of other people out there who believe there are women that are super fertile, and that because they're super fertile, they have recurrent pregnancy loss because their body is unable to recognize when to back off, and it just kills off every embryo that is made. So there are some super fertile women where we supposedly they have a harder time, but the science on that has not worked out very well yet, and there's not like a really easy chain to follow or flow chart to follow there. But some people do believe that. Having said that, if your AMH is 7 and your antral follicle count is 7, you're not super fertile, so you probably wouldn't fall into that category.
How long after stopping breastfeeding will you AMH improve, and how much will it improve?
After breastfeeding, it varies, but it'll probably take about 2 to 3 months for it to go back to normal. And how much, it's impossible to know. It depends on how strong your ovaries are. Let me go back to that last question because I want to re-explain that a bit. The idea behind superfertility is that your endometrium will accept any embryo whatsoever. And most of those women have strong AMH. So the problem is that it's indiscriminate. It takes any embryo and then you recurrently miscarry because even the bad embryos are making it when they're not supposed to. So there are some super fertile women in that regard, but I've never seen that, and it's very hard to prove. Again, we don't have a way of testing that or proving that that's the case, that your lining is indiscriminate in what it'll accept.
Big question.
Dr. V, that's me, 31 with PCOS, took Provera to induce period, had cycle monitoring with blood work and ultrasounds, given apelcabergoline once a week, now on week 4. Was told uterus, cervix, and tubes are perfect, but my follicles are not maturing.
My follicles are not maturing. Husband has had blood work done and now sperm analysis waiting on results. What would be considered the next step?
You probably will need shots or meds to help stimulate your follicular maturation. If your Provera will not make you grow your eggs, and also cabergoline won't do that either. You need letrozole or Clomid, and you should start with letrozole, or you need shots. So those medications that you're taking, Provera only brings on a bleed. It does not stimulate egg growth at all. And cabergoline is if you have hyperlactin. So I'm not sure whoever's doing this for you is doing the right stuff, but you need medication to stimulate your ovaries to produce, mature, and release an egg.
My husband and I have been trying to conceive for 3 months, and I have been tracking with LH strips and BBT.
Okay. Should
I get testing done? How can I get a referral to you from my PCP? She dismissed fertility concerns.
Well, if she's dismissing it, go to a walk-in clinic and say you want to come see us, or just insist. 3 months is not very long. It's age dependent. So if you're so if your period's irregular, you should come see us right away, regardless of your age. If your period is regular and you're less than 35, it's actually reasonable to try for a year. 35 to 39, 6 months. Over 39 should come within 3 months. So that's reasonable.
She says the reason I ask is because I am the one with the short luteal phase, 7 to 8 days.
Yeah, it's reasonable to come see us. We can adjust that for sure.
Follow up to my 6 weeks past Lupron Depot for 3 months question. Is there a med to take to start my period sooner? I didn't realize 4 months to resume naturally.
Birth control. It's not 4 months after your shot. It's 4 months from the time of the shot. So like a month or two after you're done. And that's if you had the 3 month, the 11.25 milligram dose. So in any event, you could take birth control. It'll bring on a period.
I have a question here, and I don't know how to read the.
Sure.
There's some wild numbers in here. Numbers like let's get a serial number. I don't know what it is.
Twinges from 1 day post 5 day transfer, 3 day post 5 day transfer. Oh, from day 1 to day 3 of a 5 day embryo. Sharp twinging, often on the left side lower abdomen on the 4th day. No cramps since. Could that be implantation? Yeah, that could be implantation for sure.
Never would have been able to read that. 29 years old, the girl with the
I can only give you so much of a medical degree sitting next to me.
I've noticed there's a limit here. How long is your wait list to get to see you as a new patient?
So things are changing a little bit at VRC because we are growing so quickly. So to see me personally, it does take a couple of months, but depending on the urgency, we can make changes. And then we have new doctors joining us. So Carrie Mayrand is with us, and there's another physician that I can't disclose yet who will be joining us shortly. And hopefully we're kind of doing something with my existing colleague who's here to try and get him to take some of the patients as well. And then I will be seeing the patients that need more advanced care. Everybody will be following our protocol. So it'll be the same care regardless of who you see. And Mayrand's awesome. Everybody loves her. So, if you need to get in to see somebody, we can take care of that for you.
Not a lot.
5 more minutes?
Okay.
Or do you want to go a little longer? Because we got to eat, man. You and I are starving.
Don't worry about me.
Let's go to 9:15.
Okay.
And then we'll start eating. Yeah.
In February, my AMH was 1.05 recheck last week, now 2.35. Supplementing CoQ10 and DHEA since then. But can it go up, and what are the implications? 6 eggs in the first round, going for the second. Is something off? So
I'm assuming you're picomoles per liter and not nanograms per mil. If you are picomoles per liter, there isn't a huge difference between a 1 and a 2. It can go up and down a little bit, and there's lab error always, so there will be fluctuations in your AMH. So it depends on what was happening before. If you were suppressed for some reason, that can change things. If you're not suppressed, then it might be okay.
I just started my first IUI treatment at your clinic recently. We have had a great experience there so far.
Awesome.
How long after the actual IUI procedure will we find out if I am pregnant?
So we recommend 2 weeks, but most people cheat and try within 8 to 10 days. 8 days is really quick. It's hard after an IUI to know that quickly. From an IVF, you can. But, if you check like 10, 12 days after your IUI with a home test, it might show up positive. Don't take it as gospel, but it might show up positive. Yeah.
Hi, just finished the first cycle of IVF, 6 eggs, 2 blasts, 0 genetically normal. Second round coming up this time with loop-on flare. Any tips? I'm 43.
Watch our embryo math video. At 43, you need a minimum of 4 cycles to just get enough to get a small chance of success. So it is unlikely you will succeed on just 1 or even 2 tries. At 43, 80% of your embryos are not normal. Let's say you want an 84% chance, or even let's go for, the full deal. So you want a 95.2% chance of having a live birth. You need 3 genetically normal embryos. If you've got an 80% chance they're abnormal, and the statistics don't quite work out this way, I'm going to give you the rough math version of this. You actually need to have at least minimum 15 eggs, and that's minimum. Okay. 15 embryos, not 15 eggs. You need 15 embryos. In order to get 15 embryos, you need a minimum of 25 eggs. So if you're making 6, that's 4 cycles of IVF roughly. So it's very, very difficult at 43 to get success. That doesn't mean you can't. I'm 100% supportive of people trying, but it's tough. It's definitely tough, and you got to be prepared for a long journey. What's the wait time for laparoscopic surgeries? God, if I knew, I wish I could answer that. Right now, with everything going on, nobody knows. What's the wait time after you can start to book? Usually a couple of months. Windsor is a few months. Sarnia actually has been pretty good. They get to our patients faster. So I refer to Dr. Allen and Dr. Al-Kalani down there, and they do a great job, and they're quick. Another question here. I gave birth to my baby 4 months ago. It was a patient of yours. I'm forever grateful. Hey, Sarah. And my periods since giving birth have been extremely heavy and painful. Is this normal? I know it doesn't have to do with fertility right now. Just wondering.
Just, it doesn't copy paste the same way.
You know what? I don't see it. It's not even
just.
Here. Oh, here it is. I got it. I know it doesn't have to be with fertility right now. Just very curious. You know what? It shouldn't be heavy and painful. If you're breastfeeding, it should particularly not be heavy and painful. So maybe come in and see us, and we'll figure out what's going on.
Thoughts? Melatonin during.
Oh, you should be on melatonin before you start, let alone after. Melatonin has been proven to improve your success rates. It's part of our protocol. How long should I wait for my cycle to start before I need to take something to kickstart it? Today is 7 days late. 2 negative pregnancy tests. Crystal, that's actually exactly how long you should wait. It's 7 days. So if you're at day 35 and you've not had your period yet, go ahead and take whatever you need to take to start your period. I'm your patient, actually. Okay. Provera was because period was absent since February. We were just waiting to hear back from husband's sperm analysis. I need the rest of that. I don't know where the rest of that message came from.
All right.
Just contact the office and we will get in touch with you. If you finished all
she was the PCOS, 31 PCOS.
Oh, okay. Contact the office if you've done all your testing. Arrange what's called an I-1 appointment. It's at the bottom of your instruction sheet. You have to call us to set it up. So call us and we'll set it up for you. Hi, Dr. V. My other half is still tender after stopping progesterone and oil approximately 3 weeks ago after our second failed attempt. Is this normal? It can be if she reacts to it. And if she has those big pink welts, we should probably, or you should probably stop doing that. So make sure you're letting your nurse know and we'll address that. What are the signs to do immunology tests? Oh, great question. Either you're one of those people who reacts vehemently to any kind of bug bite, allergic reaction, never gets sick, that kind of thing, or you're having recurrent pregnancy loss and it's unexplained. Both of those are reasonable indications.
Does Lupron Depot change the ERA results?
Ignore ERA results. They're useless. ERA means nothing. It's epically useless. Do not do an ERA. Do not spend your money on an ERA. Proven in trial after trial after trial after trial after trial to be useless. It does not help. So don't bother. And yes, it would alter things, but don't do an ERA. It's completely useless. It's a pointless test. I have no idea if melatonin gummies are just as good to take. You'd have to ask the manufacturer, I would assume, but I'm sure they're going to tell you yes. I'm a patient of yours and was wondering why you choose letrozole over Clomid for IUIs. I'm on my second IUI. If you're PCO, which is a huge portion of our population, there is a study by a guy named Legro, published in the New England Journal. I think his first name is Raphael, but don't quote me on that. So they head-to-head compared Clomid and letrozole for 6 months for PCO women. So letrozole had 27.5% and Clomid had 19.1. So letrozole was almost 8% better. So that's why we use it. Last one?
Sure.
Last one.
Okay. Last one. I feel there's a lot of pressure on the last one question.
It's Tarek's terminal question.
Yeah,
Remember we said we were going to call it that.
Well, we answered a lot of them, but you had a whole bunch. You know what? Hold on. You had like a billion of them.
A billion?
Yeah. Now that I remember.
On IG?
You asked them. Okay.
It won't show you now.
Oh, yeah, you're right. Son of a gun. Hold on. Okay, here we go.
Yeah.
Can SCR be caused by too high of an LH level? I got SCR eggs in my first round, got 16 eggs, 12 mature, and only 3 fertilized, and 1 normal blast. No sperm issues at all.
Yeah, there was a recent article we posted on Instagram that said that the SCR actually can be related to your stimulation. So if your stim is really high, it may be related to SCR. Nobody really knows what causes it, but we recommend if you get really high SCR that you reduce your stim. LH, we don't know. It's possible, I guess, but nobody knows for sure.
What do you think? Oh, is that the last one? Should I stop it?
Let me answer this last one.
Okay, what do you think?
Okay, I got one up here too. Go ahead. We'll do 2 more.
All right. What do you think about the use of myo-inositol to manage PCOS if not trying to conceive? Any long-term benefit?
Yeah, it helps regulate your cycle. It's good for your insulin. It's got a lot of benefits for PCOS, so you should be on it. You should be on NAC, inositol, and coenzyme Q10, regardless of whether or not you're trying to get pregnant. Last question here I'll take, because this is a good one. How many 42 to 43-year-olds have success at your clinic? After this, many tries typically. So we don't normally let people do 4 tries of IVF. I really try and discourage it unless they are absolutely determined to only have their own eggs for the cycle, because no matter what I do, that's a huge amount of expense and I cannot guarantee you an end result. So if you look statistically, they should have success after 4, 5 tries. But do we do that many? Almost never, because usually if you do it once and you fail and you do it again and you fail, I'm going to sit down and have a long talk with you about the fact that the statistics don't actually work out like the raw numbers I just shared with you. You should really watch our embryo math video. It's an awesome video. In the embryo math video, we very clearly show that the math doesn't work out so that if you have like, an 80% chance and you make 10 embryos, 2 are normal and 8 are not. It actually doesn't work out that way at all. It's an 80% chance per embryo that it's normal. And so the probability calculation is this super crazy complicated equation that I actually had to ask 2 mathematicians how to figure out. So the bottom line is you have a very good chance of getting no normal embryos. And if you don't have normal embryos, you're not going to get pregnant. So, or God forbid you will, and then it's a disaster, either miscarriage or an abnormal baby. So it's really, really, really critical that you first determine how important to you it is to use your eggs, then determine how many times you want to try and set your goals ahead of time before you start the process, because you got to draw a line in the sand. And then when you hit that target, don't go again. And that's important because IVF can be addictive. And there are patients that just want to keep going and keep going and keep going and throwing money at it, and it just doesn't make sense. So don't do that, guys. That doesn't make sense for anybody. So what's our success rate? I mean, we do very, very well. Usually, if you're in the 42, 43-year-old category, we're going to get somewhere around anywhere from a 20 to 40% success range. It depends on a lot of factors. There are low responder 42-year-olds and high responder 42-year-olds. So all of those can vary, but ultimately that's per cycle. If you do it enough times and you give me 3 normal embryos, I'm going to get you pregnant. So it's how many genetically normal embryos you can produce, not how many cycles you do. And you normally would need several cycles to get there. We will repost that COVID vaccine video on YouTube shortly because that was a mess. But thank you for watching, as always. Love the questions. Make sure you like, comment, share. If you are on Instagram, we really would appreciate it if you follow and get your followers to follow. I find it's incredibly difficult to get Instagram to grow, so we would like to challenge you guys to help us out with that. If you're on YouTube, definitely subscribe. YouTube is growing usually about 10 people per day, so our YouTube channel has grown quite a bit, and we would love to have more. So let us know if there's a specific topic you want us to focus on, and we can do that for you too. Have a great night, guys. Stay safe. Get vaccinated, and don't believe toilet seat scientists. Have a good night. Bye.